Heart disease is the leading cause of death for both men and women around the world, and many times we don't even know we have it. How can we recognize it in our own lives? Cardiologist Dr. Mohamed Shalaby from the Texas Heart Institute recently stopped by with the answer. Dr. Shalaby, it's amazing to me how much heart disease really is in our control to avoid, but people just don't know.
Yes, and since 1900 until today, heart disease is the #1 killer for people in the developed world. And with all the technology that we're coming up with and all the money that we spend, we are only reaching to the tip of the iceberg. So most of heart disease are in people that do not know that they have heart disease.
Yeah, in fact, a lot of people may be diagnosed with type 2 diabetes, and they think they're taking care of the diabetes part and taking insulin and things, but they don't realize that's breaking down basically every organ in the body, including the heart.
Right on the money. And the research have showed us in diabetics in particular, they have as much risk of developing a heart attack as someone who already had a heart attack and waiting for another one. And that applies to a lot of other population as well who has that risk.
Yeah. When we say cardiovascular disease, what is it exactly?
It is a disease that affects the vascular system, whatever it is, and the most common manifestation that we see and the most devastating one are a heart attack and a stroke. But also it affects the peripheral vascular system when people have blockages in the periphery. It affects the vascular system when we have abdominal pain that's caused by decreased blood flow to the intestine.
Yeah, and you talk about the blockage. We just saw a graphic there that showed what we call plaque buildup.
That's right, and that's right. And this is a very important one, especially when we're trying to stop cardiovascular disease early on. Detecting this plaque and preventing it from progressing further becomes a key thing in the treatment. And it starts developing in the second decade of our life, and it keeps progressing. And it's all up to us in terms of our lifestyle, our stress level, our diet, to prevent the progression of this plaque from developing into a complete vascular disease in our adult life.
Yeah, we say about 600,000 people die every year in just this country.
In this
600,000 people die. The sad part is probably about 80% of them, it could have been prevented. And as you mentioned, something as simple as diet. I still think a lot of us think it's bigger than that. We think it's a special medication. There are medications out there that can help, but it's not the full part of the answer.
It is not full part of the answer. And this is the unfortunate fact that today, like every other day in this country, around 2,600 people will die from vascular disease. 50% of them are very normal people who have no prior diagnosis. And our failure to reach out to these people, detect them early enough, and give them proper treatment is what leads them getting this unfortunate ending. So most of our effort in the medical community now have shifted from receiving this patient with a heart attack in the emergency room or in the operating room to reaching out to the public and educating and modifying the lifestyle in a way that we can reach to heart disease before it happens.
All right, so let's go through just a couple of the symptoms, and we can't rely just on that. And sometimes women and men may present differently.
That's true. That's very true. There are symptoms that most of us are familiar with, and this we call the typical symptoms of angina or heart attack. That's a pressure in the center of the chest, usually radiating to the shoulder, to the neck, or to the jaw. And usually it is reproducible by exercise. So you go upstairs, you have the angina, you got to stop, take some rest, it goes away. But that only accounts for 50% of people who really have angina. The other 50% comes in a different way. And here's a trick to educate people about that sometimes people come with fatigue, just no energy to do whatever they used to do before. That's most common in older population, that they will come with that.
And the tricky one is people think they're having just simply heartburn, and it's really a heart attack.
That's
risk factors, and again, this is another thing that this isn't the whole story, but it's something for you to pay extra attention to.
That's right. And we have the traditional risk factors, which, again, your family history, your other medical conditions, mainly diabetes and hypertension and high cholesterol, to your level of activity, to what type of personality or what type of stress you're exposed to. Smoking, of course, come on top of the list. Besides that, we have come to discover other ways to tell who our people are at higher risk of that. That includes some technology that developed recently in the last 15, 20 years, and some lab work that will give us more objective ways to assess people and tell them that even though you don't have any of these risk factors, because we see that all the time, people who have lived a very good life is still having a heart attack, we're able to tackle these people and tell them, yes, you are at risk because you have so and so and so.
All right. Let's talk about some things that we can do right now, even without the doctor, to try and minimize our chances of having a heart attack. And one of those things is taking a low-dose aspirin.
That's very good. Now, aspirin as a low dose have been very popular and very debatable in the medical community. We don't have a large-scale study to prove its benefit, but all us as medical practitioners feel that if aspirin doesn't hurt you, it will help you.
Okay.
Especially if you had a heart disease from before.
Yeah, keeping your blood pressure and your cholesterol under control. And again, medicines can help, but that's kind of a lifestyle change as well.
It is a lifestyle change. And in my own practice, since we have a huge focus on lifestyle modification, and we work with a team of dietitians, of exercise trainers and life coaches, I have been able to take my patients off medications, not one medication. I've been able to take them off all medications for high blood pressure, medications for cholesterol and diabetes, just by losing weight and exercising on regular basis.
Yeah, because you're attacking, no pun intended, you're attacking the real problem.
We're attacking the root of the problem.
Yeah.
Yes.
And I want to wrap up again with the new technology to detect what might be going on.
Very good. And Deborah, we're really fortunate that we live in an age where we have developed technology that is cost efficient, that is non-invasive and time efficient. And what we're looking here is a snap from what we call IMT, intimal medial thickness. And this very simple test will look at a segment of the artery in the neck and will tell us if there is plaque there, how thick it is, what is the vascular age. I can tell you that I saw people and their age is 35 and their vascular age is 55 or 60.
Wow.
And this is a very affordable test, very simple with no side effects.
All right. Thank you very much for the education. For more on Dr. Shalaby and Healthy Start MD, log on to drshalaby.com or healthystartmd.com. That visit just might save your life.